Program is Podium, coming to you live from the Sierra Leone Broadcasting Corporation. The Sierra Leone Association of Social Workers is observing this March as Social Work Month on the theme, the role of social workers in fostering a shared future for transformative change in child protection and welfare in Sierra Leone. Well, this really aims to raise public awareness about the crucial role of society in protecting children and promoting their welfare. Social work practitioners, students, and advocates are invited to join the discussion and strategizing on development of sustainable social welfare structures for the betterment of children in Sierra Leone. Well, in the studio is Michel Conteh, Secretary General of the Sierra Leone Association of Social Workers. Welcome to the program, Michel.
Thank you very much.
There's no better time to discuss the important role social workers play than now, when we are having this issue of kush, which has become a malaise in our society. It has a tendency to eat into our fabric and also destroy the next generation of Sierra Leoneans.
Right, so, and I agree to that. In fact, amongst other reasons, we started the month celebration on mental health and drug abuse. So the World Social Work Month is a period where across the world, social work practitioners and promoters come together to promote the roles of social work towards developing a society. And it's a month-long activity plan that we spread it across. We had the themes localization on drug abuse and mental health through a symposium at Friday College on the 1st, where the Minister of Social Welfare made commitments through an action that has been taken by providing or creating a directorate for psychosocial support and mental health at the Ministry of Social Welfare. And months before our celebration, about 6 months ago, we had started a public awareness raising on the effect of drug abuse in the country. Specifically, or precisely on the 10th of October, we asked for government urgent attention and action on the proliferation of kush drug in Sierra Leone. Unfortunately, we have had a reason to reach this long, but it tells you that the social workers have been foresighted. We knew there was a looming danger, and we needed an urgent action to that particular
So were the social workers not made use of?
The unfortunate side of it is that we have not had an infrastructure which would incorporate expertise in this fight. We have only been hearing about the too much of publicity around it, but the actual action to take place had not.
But a rehab center has already been established at Hastings.
We're now talking about 32 that are dead, and we're only talking about one rehab center within the country. Those are the ones that are dead. What about the many of them that are already on the streets? Can that particular rehab center take all of them? And also, professionally, there are steps to rehabilitating drug victims or drug users.
Have those steps been missed?
We think, as professionals, we think that they have not been achieved so far. Because taking, I think about 2 days ago, I saw a photo on social media about people being captured, bobbing their heads, who are drug users and things like that. For us as professionals, we think dealing with drug abuse goes beyond just gathering them and putting them into a rehabilitation center without not knowing the process.
So do we even have the social workers to respond to some of these needs, to respond to some of these emergencies that we are having now?
I will tell you with emphasis that yes, we do. We only need to incorporate them and make use of their services. And that's why, amongst other reasons, we're saying now this is March month, it is high time we started thinking about and knowing what role social workers play in many of those things. Yeah? Mental health and drug abuse is just one practice area. I told you that it's a month-long activity. Tomorrow, World Social Work Day, we'll be dealing with child protection and welfare. If we cannot deal with a society that has a potential to have a future where children will be safe, then we have no society to live with. Now this future is being threatened by this drug abuse, and because it is being threatened by this drug abuse, we're feeling that the children's future are also being threatened. So dealing with the drug abuse, the users, and the chains of manufacturing and production of it is very important and very vital. That's why we say for us to address this particular issue, it needs all hands on deck. but also it needs a professional to be incorporated into all of these actions.
Okay, he is Michel Conteh, who is the Secretary General of Sierra Leone Association of Social Workers. It's Podium. We are going for a short break. After the break, the program continues. Go and do Sierra Leoneans know the importance of social workers?
I am convinced that we're gradually reaching there, because compared to how it was last year when I came here and how we're going, for the fact that these institutions are now considering to have psychosocial pillars in their institutions, which means that we are gradually getting to that point where people understand the roles of social workers. Whatever be the case, most of the countries that we admire time like this have this infrastructure which help to develop their countries. And for us, in fact, we think a step further than where we are now would be to regulate the profession. So that's which the minister have made commitment to, that they are already having a bill that has been proposed.
Yeah, I remember interviewing last year, so
yes.
You did speak about the bill also.
Yes, I spoke about it, but there were a few gaps in the bill, which we think is
have those gaps important. Been filled?
And she has promised that they have been filled. One of which is the education. You cannot deal with practice if you do not regulate the education. Times like this, we are hearing about people coming to the course because they feel they cannot go to other departments. We think we can accommodate them, but by the time you are graduating, you should have felt the importance of the need to be a social worker yourself. So that's why I'm
because many people think it's a cause of last resort.
Well, as a testament to the cause, I don't feel it's a last resort. As you already know, I'm also a lawyer. I feel more a social worker than a lawyer, because I feel that without social work, I cannot succeed as a lawyer. A lawyer is possibly there to deal with soliciting and being a counsel in court. When a lawyer wants to succeed, you need the evidence, but also after the evidence you would have dealt with the evidence, what happens to those that are victims or those that are perpetrators of those offenses. The social worker comes in to rehabilitate the society. That's how important a social